This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Lung cancer claims more lives than any other cancer, but new cases are decreasing in part because people aren't smoking and also because of early detection and treatment. Here to share more about early detection, we welcome from Providence Cancer Institute, the co-director of the Thoracic Oncology Program, oncologist Rachel Sanborn. Good morning, doctor. First of all, let's talk about this new research that was just published.
Thank you for having me.
You bet.
The study that we published was a trial looking at CT screening for patients who are at high risk of developing lung cancer. So those people who've had a heavy smoking history, who are either current smokers or have quit just within the last 15 years, and who were between the ages of 55 and 74. What we were looking at in our screening program was about comparing the rates of screening and the outcomes of screening in a community setting, like in the Portland area, compared with the large national randomized trials that showed that screening for lung cancer indeed found cancer at earlier stages and saved lives. There were questions at the time that that large study was done nationally as to whether in community settings those same findings would be true. And indeed, what we found is that in over 3,000 people in the Portland area who were at high risk for developing lung cancers, with lung cancer screening, the vast majority of cancers, when they were found, were indeed found at early stage, when they are able to be treated to try to cure those cancers and can improve outcomes and save lives.
Wow. Well, you mentioned who should be screened, essentially. What does screening involve?
So screening for lung cancer involves a once-a-year low-dose CT scan of the chest. It also, very importantly, involves tobacco cessation counseling for those people who are still continuing to smoke, because quitting smoking is the single greatest thing that a person can do to decrease their chances of dying from lung cancer. But the screening itself then are the once-a-year images with the CT scan, and then following up with the doctor who is ordering those scans to have advice about what the results show and what the next steps need to be.
It sounds like this should be something like comparable to a mammogram for women, that we should be getting, the people at risk should be getting these screenings.
That's absolutely the case. And in fact, the data showing that CT screening for lung cancer saves lives is stronger than the data that mammogram saves lives. So more people can have lives saved with CT screening for lung cancer. But yet at the same time, recent data from the American Lung Association told us that in the United States, only about 5% of people who are eligible for screening for lung cancer actually get screened. So there's a huge number of people out there who are eligible to consider screening who never get it.
Yeah.
A lot of lives at stake.
Right. But there are also people who get lung cancer who've never smoked.
That's absolutely the case. And in the United States, 10% of men and 20% of women who develop lung cancer have not been smokers.
All right. Thank you so much, doctor. For more information on lung cancer screenings, call 503-215-6014. We'll also have a link to more information on our website. Again, Dr. Rachel Sanborn, thank you so much.
Thank you for having me.
You bet. We'll be right back with more information, or more AM Northwest. Stay right there.